a great question, and I think, it's talked about a lot, and I think it depends on the type of scar that we're talking about. So if we're talking about a surgical scar, what I do depends a little bit on the patient history. So if the patient has a really strong history of having hypertrophic scars or thickened scars, I'm more aggressive about treating them. So oftentimes I'll actually start lasering at the time of suture removal. And really following them very closely. Sometimes I'll include the addition of maybe doing intralesional injections of a steroid to make sure that we're really optimizing our results. But I think you can safely start on a surgical scar, certainly a cutaneous surgical scar, from Mohs surgery or an excision or a skin excision, within 4 weeks of the procedure. However, when we're talking about burn scars, that's a very, very different scenario. And what I really want to make sure is that the skin has fully epithelialized from the burn before we start doing any additional damage. Yeah, so crepe skin. So this is a great indication for that. So again, you have to make sure that you're conservative with your settings, but certainly it will improve the crepiness of skin. You probably have to do a little bit more than the micropeel settings, but again, conservative because it'll be off the face. But yeah, absolutely, it can address that. I typically tell people it's going to, for the chest, it'll be multiple treatments because anything off the face is going to take longer to heal. And so we do more conservative settings, and typically I'll do multiple treatment sessions. But patients usually are very, very happy afterwards because they get a benefit of really improving the dyschromia, that discoloration that goes along with crepey skin on the chest.